Hey, it's Chris with ROE Dental Laboratory, and today we're going to be discussing the Ultimate Restorative Protocol Guide. Now, this guide has a bunch of different patient scenarios for full arch cases, whether it's fixed or removable, and it tells you what the patient's presenting, and then you choose your kind of restorative workflow, but it covers digital and analog workflows. Specifically today, we are going to be discussing a digital workflow called Grammetry. Now, Grammetry is a photogrammetry alternative. It gives you the same accuracy and same outcome as a photogrammetry workflow, but it just uses your intraoral scanner. Now, this workflow itself, with Grammetry, is going to use the OptiSplint to get you to your printed trine or your prototype and then final zirconia. Now, we have all the different steps laid out in this book, and it tells you the materials needed and the steps to send to the lab. So with Grammetry, the patient will have an existing denture because of course they've had surgery, implants are healed, now they're ready to transition into their prototype, the final. So they have an existing denture. The way this workflow works, again, as I mentioned, step by step here, but you're going to go ahead and remove the denture they're wearing, and then you're going to seat the Grammetry, the OptiSplint scan bodies onto each of the multi-units. Seat those, you lute them together with this provided mesh. So once those are all luted together, you remove that from the patient's mouth, and you're going to go ahead and scan the top of that OptiSplint. That's going to give us the exact multi-unit abutment positions needed to move forward with the case. Now you're not done. The next step is going to be to go ahead and reline the denture that they're wearing. You may have to relieve it a little bit because ideally you're going to put healing caps back on each of those multi-unit abutments. And then you take the relined denture, seat that, get it comfortable in their bite, have them bite down, have that PVS set. Next, you're going to scan the opposing. You're going to scan the denture itself, capture some of the tissue as well, or some landmarks if you can. I mean, the denture, of course, is covering a lot of the tissue, but capture as much as you can. And then, so now we have upper, lower bite. Next, we want a 360-degree scan of that denture. Now, depending on your intraoral scanner, there is a specific way you may have to do each of these steps. This is scanner specific. Now we're capturing the positions of the multis in the mouth. You can do one extra step if you want. You do not have to do this. But you can also scan the edentulous ridge of each of the positions as well, in addition to that 360. Again, a little overkill, but more data is better than not enough data. So once you have all those records, and I know I talked a lot about that, but again, it's in this restorative book. All the steps are there. It's also on our website. Send that to the lab. The next step is we're going right to your printed trine, and this will be a direct to multi-unit abutment printed trine, or because you have an OptiSplint, it is a verification jig. You can send that to the lab and we can put some copings in your prosthesis. Totally up to you which workflow you go with there. But the next step is your printed trine and then final zirconia. If you have any questions, of course, give us a call here at the lab. You can reference this book online, get an eBook for it, or we can send you a physical. And of course, check out our socials for the latest and greatest in dental technology. We look forward to working with you on your next case. Thank you.